Hi, so great to see you all. Hi, everybody.
Hi, Maura.
Hi, how's it going?
Hi, David. So good to see you.
See you as well.
This is going to be a fun one. Hi, Jossie. This is definitely the best state update I've given all year. So very happy to finally give some good news, because everyone worked really hard on the budget this year. And, you know, to be honest, we started out with a very good budget. So from Governor Healy. So I'll just give people a few more minutes. Jump on.
I guess you'll explain. I'm curious as to what exactly happens with Operation House Call now, what exactly that means. That's been codified.
I know it's kind of a complicated bill, but we'll go over it today in case people are interested in learning kind of the ins and outs of it. But you know, 10 years of advocacy on that one, so it feels pretty good to say.
I guess my major question is it now going to be like a requirement for all Massachusetts medical schools and we're like our state or something?
Yeah, no, so we're unable to go above the medical boards to make something a requirement. So we kind of worked around it in our language, and I'll explain that. We need to get something done on a national level in order to get a requirement or a mandate for new curriculum to be added, because then it needs to become part of their boards. But we'll talk all about that.
Excellent. Cool.
Yeah. Excited.
I won't jump to the end. I'll start with the introduction and go through. Wait.
Yeah. Well, I think we'll go pretty quickly through the budget today. Yeah, and so we may as well get started. People can jump on and hear. But thank you everybody for coming. I think it's really hard to get a full understanding of what transpires between January and the end of the the budget session, especially this year, because the budget or the bill that Governor Haley put out didn't actually come out until March. So we had a really short time frame to advocate for these priorities and to figure out what we really needed out of the budget. So let me just jump in and share my slides so I stay a little bit on target here. Get this out of the way. Okay. Oh, if anybody doesn't know who I am, I'm Maura Sullivan. I'm the Director of Government Affairs and Health Policy for the ARC of Massachusetts. And I usually do these webinars just the first Thursday of each month. When things get a little bit busier during the year, you might see me holding 1 or 2 special sessions, but this is just to give you guys a good update on what's going on legislatively here in Massachusetts. And I include the ARC's mission. And I'd say the last couple of years through COVID, when I talk about our mission, I feel very defeated. Like this is a very, very challenging mission right now with our workforce shortage crisis and that intersection with COVID and where it left our community. But I have to say that, you know, I'm feeling a lot more hopeful now as we have a new administration. We have hopefully really, you know, come a long way with getting COVID to be behind us, but we still are facing huge workforce shortage, systemic crisis, and there are still thousands of individuals who are not being served. And you know, that's kind of the crux of our priorities for the legislature right now. So today I'm just going to talk about the conference committee release of the FY24 budget. So just to remember, the budget is in the hands of the governor now. And she has 10 days to sign it. Sorry for the background noise there. So this is sort of a period of time where we are not quite 100% celebrating in case there is any kind of veto from the governor. We don't expect one. And to be honest, a lot of the budget that we're celebrating today was proposed by the governor. And we, typically don't see them veto their own proposals in a year where there's been really significant revenue shortfall. You might see that. But although we did have some shortfall in April and May, we are not in that type of position this year to be super worried. Okay, thanks, Kathleen, about vetoes. We did, however, do a veto letter to the governor, just to be sure. And then we'll talk about how the budget has met our asks, our priorities, and I also ask you all to reach out and thank your legislators for this budget. And then we'll just, if we have time, which I think we will, we'll focus a little bit on the upcoming legislation that we still really need a lot of help with. The summer is such a hard time to have people available for hearings, and they come up really quickly. So we found this summer we got slammed with hearings in July, and it was really hard to bring constituents in to testify because of the short notice, because of summer. So we're hoping as we move into the fall, we can get people better prepared for the fact that you get about a 1 week notice for the hearings, and that there's still some really significant priority bills that need your support. So those are the bills that will be heard in the fall, but there's bills that have already been heard that also need your support by following up with your legislators. So we'll talk about those. Okay, and then we'll have time for question and answer. But stop me anytime because only not too many people just yell. So just looking at the conference committee budget, we are really happy to say that the ARC's priorities were all met in the budget. So our requests to conference committee comes out of what's possible for us to request, which means what did the House chamber support in their budget, and what did the Senate support in their budget, and that's what we can go ahead and advocate for. So we can't just, for conference committee, we can't just have our own priorities. It has to be what came out of the budget process through the House and the Senate. And what we typically want is everything good that the House put into the budget for people with disabilities, and everything good that the Senate put into the budget. We want them to accept both sides and give us the best of the best, which is what they did this session. So we asked for some additional money in community day and support, community day and work programs. And that money was really specific toward those individuals who are actually not back at their day programs, but may need that one-to-one support in order to participate. We've been focused on those individuals who have been left, behind just because of their need for one-to-one support and the incredible inequity there. So this money came through. This is great. We also saw an additional 15 million that's a set aside. So this wasn't additional funds, 15 million of additional funds. That's wrong. Set aside funds that will be expended by the department. So this was part of the original budget, but what they're looking to do is really use this money to redesign the service system to respond to the new needs created by COVID, and really get a little bit more creative on how to better serve people, either if they have to serve some people remotely, or even thinking about more community based supports. So this is really, I think this is really progressive and great, and we just really need to make sure that this is actually happening. So the implementation of this is key. And hopefully using some of those funds to recruit and hire. So you'll probably see that in the form of bonus, sign-on bonuses, retention bonuses, which may or may not be helpful enough. The main thing that we're looking for, separate from this line item funding, is to increase the rate of pay for the workforce so that we can get more people in, recruit them and get them to stay, because the salary is a living wage, is worth staying for. So I thought this was a really good slide to share. I know it's a lot of information on it, and you'll get these slides after the presentation. But the other piece that we were really happy to see and had asked for is the transferability between line items. And I don't know if this is hard to understand or not, but really what happens when the workforce shortage crisis is in play is that many of the line items are not going to get full utilization of their funds, because there isn't enough workforce to use the programs to the extent we need to. So for example, we can't bring back enough people into day and employment. So maybe we won't use all the funds in that line item, but we don't want those funds to just go back to the state. We want to say, well, who's supposed to get those funds? The individuals. So let's find a way to get those extra funds that weren't used because of the workforce shortage back to families and individuals. So this line item allows DDS to do that kind of transferability, say from community day and work to family support. The other thing it may allow them to do is transfer to transportation line items. And as we work through this workforce shortage, we hope that people are going to start to come back to jobs in human services across the board. But, it may be that we're struggling in transportation or other areas more. So this is a great line item. We just need to, again, make sure that this is actually happening in this budget, that the money doesn't just revert back. So something we have to stay on top of for sure. Sorry, this is a huge, a lot of information on this spreadsheet, but I just wanted to give you a quick idea. Like, these are all the line items that we advocate for. And, for an idea of a total, I mean, we're close to $3 billion in our DDS line items here. And some of these that I bolded, you'll see are actually proposed by the governor, like the increase in community residential, that was part of her proposal. And then some of these are increased through the legislature. Not a huge amount, but what we asked for. And then when you go down to mass health, this is a huge, huge line item, the $4.4 billion. This is where our $200 million for mass health day programs exists. So that line item is really important, separate from DDS. And then the other line item that's super important is the chapter 257, right below it, I didn't bold it, human service reserve. So that's chapter 257. That's the workforce rates that affect our DDS workers. And we did see a $54 million increase in this line item. I know it's confusing. We went over this before because you see last year's budget at 230 million and this year's at 173, but it's because they're affecting different areas of human service workforce rates. And this year, this is actually a $54 million increase from 2 years ago. So overall, that's just a quick summary. Here it is, a little bit easier to read. So what are we looking for the governor to not veto? The additional $3 million in CBDS, and that is really hopefully going to be for those unserved or underserved folks. We did also see the legislature put an additional $2 million in the autism kids waiver, which is phenomenal. And so we want to make sure that doesn't get vetoed either. And then of course, her proposed money of 200 million for day programs and 54 additional million to chapter 257. So those are kind of the big items that we don't want to see change. We don't think they will. And they're sort of the areas that we're really celebrating right now. Oh, I see something in the chat. Oh, quick. Oh, I'll send these. Yes, I will. Okay. All right. So now I just, take a moment to talk about our legislative win. So I think some of you might not know that occasionally we get legislation passed through the budget. And this is not the way things always have worked. I noticed it first kind of happening during COVID, where we were able to pass autism police training through a bigger piece of legislation through the police reform bill, and to kind of put our language into that bill, which was great. And then last year in our 2023 budget, we were able to get two pieces of legislation through the budget. So the whole language of the legislation gets put into the budget, plus the funding, and it makes it for a much faster process, because as you know, the legislative process is 2 years when the budget process is just 1 year. So it's really wonderful when we can make that happen. It's not always, I would say sometimes it's frowned upon to kind of, they call it do policy in the budget. But I think when a legislator, a senator, or a rep, or leadership really wants something done, this is a really good way to get it done. So this is how we got Operation House Call done. Chair John Lawn of Watertown, he put through an amendment that basically was the language of our bill, and funding of $150,000 a year to cover the maintenance and expansion of the program. The House passed it, of course, and then the Senate did not accept it. So it went on to conference. So that's probably where you saw a lot of like action alerts floating around, because we really wanted the conference committee to accept it, and they did. So what that means is we basically have a win. We passed another bill, and as soon as the governor signs it, and the law will codify this longstanding program and bring certification to all schools that participate, along with kind of the most important part, which is funding for the ARC to grow and maintain the program. So Jess, I know you had some questions specifically. I'll tell you a few of the specifics. The bill will sit with DDS as the main kind of oversight for it. I wasn't sure if it was going to go to DPH or DDS, but it seemed to land in the administration line item for DDS. So they will be kind of overseeing it. And what they will be doing is, as long as a school meets all the requirements of the bill, so that's basically the Operation House Call model in a full 6 hours of training, then they will be come certified by the state of Massachusetts. So so we're excited to see that. We actually are also excited because the language of the bill allows us to grow to dental schools, basically all health professionals. So dentists, nurses, PTs, occupational, they're all ancillary providers. And of course, our medical students, where we are already in all the medical schools in Massachusetts. So that will be working to maintain and grow those programs within. So, sorry, any questions? Jossie, did that answer your questions on Operation House Call?
It did, yeah, thank you, thanks. Yeah.
Welcome. Anybody else have questions on it? Or, I kind of flew through the initial budget too. So any questions on that part? Okay, so thank you to everyone who participated in those action alerts, who not just the action alerts, but reached out, to your rep and senator, showed up at the State House. I know a lot of you did. and advocated for these really important priorities. We still have such a long way to go. I mean, we're celebrating this budget, but we know we're still in a very severe workforce crisis that's going to take many, many years of advocacy to get back to the services and supports and the safety net that our community truly needs. So this is a good budget, a win for us, but the work is certainly not even close to done. But that said, because the budget is pretty much complete, and there may be some other budgets that come out, they'll typically do sort of secondary budgets along the way, but we're going to be kind of shifting our focus to legislation now. And because we have between now and the second week of February to get all of our priority bills out of committee. So even though that seems like a long time, it's the middle of the winter by then, it goes really quickly. And I think our best strategy is to get as many bills as we can out before that date, right? Because the more bills that come out in February, which is, the final date that they're allowed to be out of committee unless they get an extension, that only gives us really a few months to get them through the next committee, which would typically either be Ways and Means if there's money involved in the bill, or third reading. So those are typically the committees that we'll be dealing with post February. And the problem with that is, we got another budget we're advocating for by that point. So that said, we need to move now as quickly as possible to push our legislators and our committees to release the bills that have been heard, to not sit on them until February, and then to get our reps and senators 100% behind these priorities. And so I know there's a lot of bills, there really are. And my recommendation to you is, pick one or two bills that you feel really strongly about to go to your legislator and to get them to make this a priority, whether they're the sponsor or just a co-sponsor. They should be a co-sponsor if they're not. They can make a difference. They can write letters to the committee. They can, speak to their other colleagues about getting them on board. And they can even give testimony at a hearing, even if they're not the sponsor of the bill. So looking at what's already gone to hearing, it was, like I said, such a busy summer. And we did have really successful hearings. I know I said it was hard to get people in, but one thing that was super helpful is having the hybrid ability. So we had a lot of people coming in person, which is so powerful, but then we also had a lot of people that were able to come virtually. And I think that was also very powerful. So we kind of blew away the committee on our workforce bill, and not to spend too much time on what has happened, but we did, I think, have over 50 people signed up to testify for our workforce rate increase bill, which really is a huge number. We ended up, the committee was very efficient and didn't have a lot of other bills scheduled for that day. So made it through the hearing pretty quickly. And so that bill needs our attention. We've got to get to children, families, and persons with disabilities and get them to pass this bill out so that Ways and Means can take a look at it. They're not going to look at this bill until they know that the committee has passed it, right? It's not worth their time if the committee isn't going to pass it out, even though we've been kind of talking to Ways and Means about this bill for a long time. Again, we want to see the workforce rates increase to that 75th percentile of the Bureau of Labor Statistics, which will get the rates up and over $21, $22 an hour, and continue to grow with inflation and the BLS in general. So super important bill to contact your legislators on if they're not already a co-sponsor, but we have like half of the legislature co-sponsoring that bill, which is pretty amazing. So these are the other bills, you know, that have already been heard. We had really good news on the blue envelope, and I know Marie was on here. She testified for that, and it's already been passed out of committee, which is fantastic. And that's the autistic driver bill. So, you know, if a driver chooses and they're autistic, they can have a blue envelope in their visor or in their car. And if they have a traffic stop or an accident, they're able to give this blue envelope to the policeman, and it helps for the police to understand that this person has autism, and these may be some of the either accommodations or some limitations they might have in this kind of an interaction, especially with, you know, high levels of stress going on in those situations. So obviously the committee loved this bill and passed it out really quickly. So now we are working to get the next step, which would be Ways and Means to pass it through. And they're already looking at what's this bill going to cost. So they're going to work. So we got some, we have amazing advocates working on this. Advocates for Autism has made it a priority. And Elise Levine Kanji just did a great article for BUR on it that we'll share from the ARC. And so hoping to get more media and really get that one through. But anyway, so, and then as you can see, Operation House Call, we can check off, and all of these other bills have gone through. So if any of those bills are super important to you, it's not too late to reach out to the committees that they are currently in and ask your legislators or ask the chairs of the committee to please pass these bills. We have a list of all the bills and where they're currently at, and we can send that out to you. I'll send it out with the PowerPoint today. Okay, so then the bills that will be heard this fall. My suggestion is, if any, and I may have missed one or two because I did this right before I jumped on. But if any of these bills are important to you, I would say get your testimony ready now. I know it's August, but it's coming in September. We know already the date for supported decision making, SDM, is September the 18th. That's not on the hearing calendar officially yet, but we were told the date. So I think it's fine for us to let people know. We have a huge coalition for that bill, and I think we're going to be able to move that right through committee pretty quickly. The other bills that you might be interested in, kind of a new one that we're just getting out there, is the universal changing tables. And we're going to do a webinar on that in the middle of August. I'll get the date out soon for that if you want to learn more about it. But it's a really important initiative. If you have anyone bigger than an infant that needs to be changed or has, you know, bathrooming needs when they're out in the community, you will understand why this is so important. They're just, you know, typically only infant-sized changing tables, and people are forced to lay on the dirty floors or not go out at all, or limit their eating, limit their time out. It's just something that really, really needs to get done. The other bills that will be coming, so we had our hearing for community college for DSPs, and we had a fire right in the middle of the hearing. So we all got evacuated, and that has not been rescheduled yet. But the interesting thing is the governor's budget that we were just talking about actually has community college as a free option for people over 25, which is fantastic to hear, because that would cover many of our staff. But we're still going to work on this bill for, you know, those who are under 25 who really want to go to community college and are part of our human service workforce.
There's
Okay,
a question
so-
in the chat about Katie's law.
Yeah.
There's a question in chat about Katie's law.
Oh,
so-
about Katie's law. Oh, sorry, let me look. Oh, what is Katie's law? Good question. Yeah, we use these short terms because all of the bills have such long names. Katie's law is updating archaic language in our laws across the Massachusetts chapter law. And this is a bill that absolutely should have passed the last few years. We did a ton of work on it, kind of deep diving into why just changing archaic language like mental retardation and other words that are extremely outdated in our chapter law wouldn't be a simple thing to do. The Committee on Children and Families last year really spent hours and hours, like hundreds of hours on this bill, and they were very determined to get it passed. I think this is where we come back to priorities. And if the legislature doesn't hear from us, they may think it's a great bill. They may think it's a needed bill. They may think it's a no-brainer. But if they don't hear from enough people, it will never rise up enough to make it to the docket. So I think we struggle with that, even though everyone feels very strongly that language should be updated in our chapter law. These other priorities tend to, get in its way, really. But we have a super strong sponsor, Representative Mike Finn, and he is determined to get that bill through. So I think we will see it get up there. So when it gets out of committee, that's one of the ones we will be pushing Ways and Means to pass, because it's not a money bill, so it might not even go to Ways and Means. So anyway, does that answer your question? I can send out fact sheets on any of these bills. We're finally up to date on all our fact sheets. So
Actually,
the
I was
only other
curious.
thing, yeah, go ahead.
I was curious about the language you want to change. Because I know on the federal level, mental retardation has been changed to intellectual disability. Has that happened on the Massachusetts level, or is that what we need to do?
No, it has not. Yes, that's what we need to do. Yeah, there's a lot of language. We were hoping to change it all to intellectual and developmental disabilities. And what ended up happening there is there was some concern that changing the language might change eligibility for certain things. So that was why they needed to do this kind of deep dive. And actually Leo spent an entire weekend kind of looking at the language, and the only thing he could figure out was like that maybe it might give more people access to free like fishing licenses. Like, it was so random, yeah. So it's not going to cost or change eligibility. And I think we just have to get that message out there that we're tired of seeing, and it cuts across chapter law, and we need to have this change in all of our, medical books and diagnostic books and all of those things as well. But if we start, it will also help us with policy and other important laws that need to, get more up to speed. But yes, yeah, go ahead.
This sounds similar to the law about fetal alcohol syndrome, to make it in line with the federal definition of developmental disabilities.
No, I think that might be where it is getting a little bit confusing, because we're not changing a definition in this bill. We're just updating old language in our chapter laws to reflect better language, more appropriate language. Whereas the DD, the developmental disabilities bill, that's actually changing the definition in Massachusetts, and it does change eligibility. So that bill is going to be a bill that is harder to pass. It's going to allow more people to get services and supports through DDS who have a developmental disability, but don't have autism or Prader-Willi or Smith-Magenis, so fetal alcohol syndrome and cerebral palsy, who haven't had supports in the past. So it's a really important bill. Do I have it on here? Yeah, DD expansion is how I called it. But this is a big bill for the, the system to take on in terms of eligibility expansion.
I was thinking it might be effective to combine the two, but actually it wouldn't because of.
Yeah,
because
we want to make sure
just want
people
to change
understand
the
that
language,
Katie's
it's
law is
distinct.
really, yeah, exactly. Katie's law is not going to cause, any new changes in our needs or funding needs or anything like that. But yeah, so on the side of all of the bills that need to still be heard, if anyone wants to prepare testimony now or get a fact sheet on any of these bills, let me know. And then, I would say if you're really invested in one of these bills, connect with me and I will help you to, be aware as soon as the hearing comes out. I can help you with testimony. And then just on the other side of bills that have already gone to hearing, looking at those, what's important to you? Do you want to follow up with your legislator and ask them to really get on board? I know this is like not the best way to see all of them, so we will send out the spreadsheet. It's also kind of hard to follow, but if there's a bill on there that's important to you, let us know. So just what I was saying, get ready now, and share our action alerts. Think of them more as a springboard. I always say this because it's good to send that letter, but then like say, hey, did you get my letter? What did you respond? Did you go to the committee? Could you write a letter? Use them as a way to jump in, and they really make a difference, especially when we can get those letters up, over 500. It means that, individual legislators are hearing from multiple constituents. And check in with your legislators often, get to know the staff, especially now the legislators are so busy. So get your connection going with the legislative director or the chief of staff. That's really who, is going to be more available to you. It's always great to meet with your senator or rep, but working that staff relationship is huge too. And then, in the end, when these bills are all positioned to pass, which many of them will be, it really comes down to these 4 individuals, right? So what we're doing, working with our reps and senators, is we're forming a funnel to these folks. And we need as many reps and many senators as possible going to Karen Spilka and going to Chair Rodrigues. And we need as many reps as possible going to Chair Michaelwitz and Speaker Mariano. So that's kind of the goal. They are going to be the decision makers on bills that get through from February on. Any questions? That makes sense to people? Right. Maria, go ahead. Oh yeah, I think you're muted.
So is it helpful if we send letters to the governor's office asking her to support everything that we're looking for to not get vetoed?
So I was just having this conversation on my government affairs meeting this morning. So the ARC is sending out a please don't veto letter. Normally in the past, we have made it shareable so that people can almost like an action alert to the governor. I think we don't need to do an action alert. I almost feel like, this is such a nobody thinks $5 million is a small amount of money, but compared to what our normal requests are, I would say this money is probably not going to be on like a radar screen for her. So I don't think it's super important, but I think a couple of people sending them would be absolutely fine. And I can share with you our letter if it helps. And it's really simple. It's just, we're really grateful for your proposed budget. The legislature was good enough to see some of the needs of the unserved. And, we hope that you maintain their increases and, simple. Because part of me thinks like, why bring her attention to it at this point? Right?
Yeah.
She's probably not going to. But in the past, when we had really deep, real concerns about revenue, we would definitely be more pushing the no veto letters. So I guess I can just send you, if you want to do it, it's great. We're just not going to be putting it out widely.
Would it maybe be more helpful or more appropriate to wait till after the budget's passed, after she signs it, and when everything we wanted is in there, to send a thank you note?
Well, that would be phenomenal.
Okay.
I think I had it in the beginning that it would be
Mhm.
great to reach out and thank the legislature.
Yeah.
Also right now, like
Mhm.
just let your rep and senator know that, we're happy with the budget, and that, it's always good to say, and we're still really concerned about the workforce shortage crisis.
Absolutely.
And we have a lot of bills and legislation they can still help us with this year.
Mhm.
Yeah. Hi, Dim.
So the workforce development bill is definitely something I'm still interested in helping out with or testifying at some point. What would be the next steps for that? I know you mentioned that that was kind of on the left-hand side where it was already something that's been brought to hearings and stuff. But what would the next steps be for that?
What's the next step? Right. That's a great question. So likely you won't have an opportunity to testify in person or on virtual for that bill, since the hearing already happened. But I would recommend that you set a meeting up with your rep and senator, take the bill, take the fact sheet, talk to them about how they can help you with it individually, each of them. You can write a letter you can write testimony. They're still accepting written testimony. So you can send your written testimony to the chairs of the committee. If you go on to masslegislature.gov, you can find all their emails, but I can send you like a quickie, here's how to contact them. Because it's Chair Livingstone and Chair Kennedy, and they're great, and they would love to hear from you. And it's been a little bit of a lull now. Like we had our hearing back in early June, I think. And we're not seeing the bill move. So it would be a perfect time to nudge them.
Yeah. So I've emailed you a couple of weeks ago just about my personal research in college and the progress. I'm about to set up a meeting with my state rep. I actually just got an email like 5 minutes ago, which is funny that we're on this call, but I'm going to be about it. It's the sub-minimum wage outlined at the federal level, which somewhat ties back into that workforce development. So should I bring that to him as well? I'm happy to, you said, bring a copy of that bill. I'd be happy to do that as well. Kind of just bring that up.
I think bringing your own research would be really powerful, especially because it does support the bill. There are some other bills out there, like there is a minimum wage bill. So I'll send you that one because you probably have a better sense of its effectiveness. The tricky thing is there's the minimum wage bill that will help workforce is actually filed by the chair of Children and Families. So it's sort of like it's her bill. I mean, it doesn't mean that she won't see the value in our bill. And, the interesting thing about our bill is it is narrow to just developmental disabilities. It's looking at increasing the rates for DDS and mass health. So it's not all of human services or all of the state of Massachusetts even. So it's a less expensive bill because of that. But anyway, yeah, I'll send you a couple things since and who's your rep again?
Rep Jones.
Oh, okay, great. Very good.
Yeah, my roommate is working for Rep Cataldo, and he's from Chelmsford as well. So he's working to kind of tie him in, and we have a whole list, but that's a whole nother story.
Oh my God, that's fantastic.
We're wrapped in it. And if there's any way we can help with the workforce development bill in the process, we'd both be super interested in doing that. So
okay, that's great. I will send you if I didn't already, I'll send you the fact sheet. That's really helpful. And Rep Cataldo is a sponsor of the bill. So
awesome.
really great.
Awesome.
Great. Yeah, any other questions? You guys hung in there for a long update this time. All right, did I miss anything in the chat? All right, well, thank you, everybody. Remember, just like really reach out to me or Kathleen or Charlie, any of us. Super easy to get you the fact sheets, to connect you, to anything, the hearing schedules, anything like that. So, and I hope everybody has a really lovely month of August.
Thanks, you too.
Thank you.
Okay. Bye,
Um,
everybody.